Hello, everyone. As you are settling in, we would like to acknowledge the Blue Fairy Adrian Wilson Liver Cancer Association, a nonprofit with a mission to prevent, treat, and cure primary liver cancer through research, education, and advocacy as our primary sponsor. We would also like to thank the Delta Research and Educational Foundation, also known as DREF, CDC of Tampa, New Birth Missionary Baptist Church of Atlanta, Share Cancer Supports Afro Share Division, and the Winship Cancer Institute of Emory University's Marketing and Communication Department for their partnership in making this event possible. This community education program will be an interactive experience. You will have the opportunity to participate in poll questions, and our presenter will answer your questions at the end of his presentation. But for now, we need you to grab a piece of paper and a pen and be prepared to take copious notes. The presentation will begin shortly.
Liver cancer is on the rise in our communities. Too many of our brothers and sisters don't know the risk. I had Hep C and diabetes, which both could lead to liver cancer. I no longer have Hep C. I'm alive, I am healthy, I'm thriving, because I found out early enough to act. I want all of us in the Black community to feel empowered by the facts, to have a conversation with our doctors about the risk and about screening. Today is your day to ask questions, to understand that we can take actions against the risk of liver cancer and live a healthier life. Do it. Thank you for being here during Black History Month to find out about liver cancer and liver cancer risk. Thank you.
Good evening and welcome to Love Your Liver Live, a Black History Month community event. Thank you for attending to learn more about this very important topic that's affecting our community. This evening, Dr. Olu, a medical oncologist, will discuss liver cancer, its risk factors, and how we can help ourselves and our loved ones. Throughout the presentation, there will be poll questions, and we ask everyone to participate. So join in as they appear on the screen. After the presentation, Dr. Olu will answer your questions. On the right-hand side of the screen, you should see a question and answer box, or this box may appear as a chat function, and you might see it on the bottom hand side of your screen if you're logging in from your phone. This is where you'll be able to type your questions at any time during the presentation. Now, we won't ask him these questions until the very end. And I must say now, we apologize in advance if we're not able to get to all of your questions. There are a few rules about these questions. I'm going to go ahead and say them now and remind you of them as we get to the question and answer portion. This is an educational presentation. So I ask you, please keep your questions general in nature. Do not ask questions that are specific to your condition. Save those questions for your doctor visit. But without further ado, let's welcome Dr. Olu. Let's welcome Dr. Olu. There he goes. There you go, Dr. Olu. Dr. Olu is an assistant professor in the Department of Hematology and a medical oncologist at the Emory University School of Medicine. He is a board certified medical oncologist specializing in the treatment of gastrointestinal cancers, particularly those in the liver. His research focuses on early and late drug stage development for the pancreatic, I can't even speak tonight, in the pancreas areas. He has been on the clinical staff at Winship Cancer Institute and a practicing physician there since 2021. Welcome, Dr. Olu. Now it's time for you to be engaged in the presentation, because remember I said we're going to get started with those poll questions. So here is that first poll question. Black Americans are more likely than the general population to get liver cancer. How much more? A, 50%, B, 75%, C, 100%, D, 150%. So come on, let's take some time and let's answer this poll question. What do you all think? I'll read the question again. Black Americans are more likely than the general population to get liver cancer. How much more? A, 50%, B, 75%, C, 100%, or D, 150%. Looks like we have some answers coming in. Let's see, what is the answer? Dr. Olu, it says 150% Black Americans are 1.5 times more likely to get liver cancer. Why don't you explain that to us, Dr. Olu? Why is that the correct answer?
Yes, thank you very much, Tina. And I want to thank everybody who's in the audience, who's taking time out of, what is a busy day in the middle of the week, to join us as we talk a little bit more about the liver, about liver cancer, and how we can prevent liver cancer, particularly in the Black community. Regarding the question, the fact is that Black Americans are 1.5 times more likely to get liver cancer than the general population. And the task over the next few minutes is to determine why that, to describe why that is the case, and what we can do to reduce that number in our community and in the United States in general. So we're going to go to the next slide, where we will then be discussing today's topics. Okay, so we have talked about how Black Americans are more likely than the average person in the population to have liver cancer. In order to move the conversation forward, we're going to talk about how the liver works, what the liver is, how it works. We're going to talk about how common liver cancer is in the general population and in the Black community. We're going to do a deep dive, really, of the risk factors for liver cancer. And then we will sort of start winding down slowly in the area that I focus on in the clinics, which involves diagnosis and treatment of cancer. And then we will end with the real steps that we can take as a community, that folks can take when it comes to discussing with their doctors about risk factors and tests for liver cancer, and the things that people can do if, unfortunately, they have liver cancer. Okay. So, what is liver cancer? So, what is the liver actually? Before we go into liver cancer, so the liver is an organ in the body. It sits on the right side of your belly, just below your chest. It is right to the right side of the stomach. For those who like trivia, we like to say how it is the largest organ inside the body. And for more trivia, the only organ that is heavier and larger than the liver is actually the skin, which a lot of people find surprising when I share that information with them. But yeah, so the liver inside the body, that's the largest organ in the body. And as you can imagine, an organ that is this large has a bunch of functions. So we like to talk about more than hundreds of things that the liver can do. So the liver is very, very important to the general health of every human being. And I think because of how important it is to the body, it is one of the very few organs in the body that can actually regrow itself. Okay. Next slide. So, in talking about the importance of the liver to the body, I like to think about the liver doing two big tasks. So you can view your liver as a large processor of food in the body. And then the second big task that it does is that it removes toxins. So when you eat your carbs and you eat the proteins, it's the liver that ultimately is involved with breaking down these carbs and proteins into more useful forms of energy. And this energy is what you then use to fix your bones and to build your muscles. The liver also works to break down fat and cholesterol. It does this by breaking it down in a substance called bile, and this bile helps your intestine to further break down fats and cholesterol and use them for the rest of the body. I think for the purposes of this particular discussion, it is this ability of the liver to remove toxic agents from the body. I think that is what is key. So the liver is the main organ. There's maybe two, maybe three organs. So, but the liver and the kidney, those are the two main organs in the body that are tasked with helping the body to get rid of toxins. And the toxins that we're talking about here, it doesn't even have to be something that we perceive as harmful. It's anything that the body perceives as not being useful. It's the liver and the kidneys ultimately that get rid of those from the body. So herbal supplements, for instance, certain medications that you take, alcohol, a bunch of other things that we put into our body. So the liver acts as a detoxifier. Okay. So now we will then talk about liver cancer in the next slide, since we have established what the liver does. So liver cancer is on the rise in the United States. Between the years 2000 and 2019, there was an increase by about 34% in the number of patients that had a new diagnosis of liver cancer. We estimate that almost 42,000 patients will develop liver cancer this year, and about 30,000 patients will actually pass away this year from liver cancer. So imagine the statistic: if 42,000 patients have the new disease and then 30,000 patients pass away. So it's a very bad disease. About only maybe 1 out of 5 people are getting out of it with good outcomes. So this is why it's very important that we're having this discussion today. Okay. When we look at just the Black community on the next slide, we're seeing that the most common type of liver cancer, which is hepatocellular carcinoma, the incidence of this type of liver cancer is actually growing in our community, whereas it is declining in other communities. Okay. Black Americans, as we mentioned, are 1.5 times more likely to get this particular kind of liver cancer compared to the general population. And we are unfortunately seeing that compared to white patients, Black patients are less likely to be diagnosed with an early stage of the disease, and they actually also have a higher rate of death from this disease. So it's rising in the Black community. We are picking up this cancer at a later stage in the Black community, and because of this, there's a higher risk of death in the Black community compared to the rest of the population, particularly the white population. So we're going to talk a little bit more now, focus our discussion a little bit more on hepatocellular carcinoma. Okay, so next slide, please. So as I mentioned, hepatocellular carcinoma, otherwise called HCC, is the most common form of primary liver cancer. About 85% of cases of liver cancers are hepatocellular cancer. We like to make the distinction between a primary liver cancer and a secondary liver cancer. A primary liver cancer actually starts from the liver and may spread to other organs, compared to what some would consider a secondary liver cancer, which starts from another organ and then spreads to the liver. So for the purpose of this discussion, we're focusing on primary liver cancer, in particular hepatocellular cancer. As I mentioned, 85% of cases of primary liver cancers are hepatocellular cancers, HCC. About 10% of primary liver cancers are cancers of the bile duct. So the bile ducts are they're kind of pipes that drain the secretions. We talked about bile earlier. So they drain the secretions that the liver cells make. So HCC is a cancer of the main liver cells, and bile duct cancer, which occurs in about 10% of cases, is a cancer of the cells that drain the bile from the liver cells. Okay, so bile duct cancer is also called intrahepatic cholangiocarcinoma. Okay, there are other less common forms of liver cancer, but these are more likely to happen in patients who are exposed to certain chemicals, some of which thankfully we do not use anymore. But I think those are the two main forms of liver cancer, are the HCC and ICC, intrahepatic cholangiocarcinoma. So we're going to talk about the risk factors now for liver cancer, particularly in the African American community. As we know, A risk factor is a reason why someone is more likely to get a disease than the average person. Okay. Common risk factors for liver cancer are divided into underlying medical conditions, some lifestyle choices, and also ethnicity. There's a big interplay among this risk factors. So ethnicity may predispose some patients to certain medical conditions. Lifestyle choices may predispose you to also some medical conditions. And we know that all of this work together and they can cause liver cancer. But before getting to liver cancer, the big stop along the pathway for developing of cancer after exposure to this risk factors is actually liver cirrhosis, and we will talk a little bit more about liver cirrhosis as we move down. But just to give you an idea of what we would consider common risk factors for liver cancer, I think the two big ones are hepatitis, which are viral infections, hepatitis B and hepatitis C. Patients that have type 2 diabetes and obese patients are also more predisposed to liver cancer. Lifestyle choices, including diet sharing, smoking, alcohol, can also contribute to liver cancer. So I'm going to pass it on to Tina now. I think she has a question.
Absolutely, Dr. Olu. It is time for a poll. So let's get those fingers ready and let's answer this poll. Which of these are risk factors for cancer? A, hepatitis C. B, type 2 diabetes. C, being Black, African American. Or D, all of the above. Let's see if we can get 100% response from those who are attending. I'll read it again. Which of these are risk factors for liver cancer? A, hepatitis C. B, type 2 diabetes. C, being Black or African American. Or D, all of the above. I see those responses coming in. Let's give it about 10 more seconds so everyone would have an opportunity to respond. Is it A, hepatitis C, B, type 2 diabetes, C, being Black, African American, or D, all of the above? Now, as we get ready to see the answer to this, don't forget to ask your questions. Make sure you put them in the question and answer section so that we can have those ready and queued for Dr. Olu at the end of the presentation. And the answer is all of the above. Dr. Olu, would you mind sharing why the answer is all of the above?
First, I have to congratulate the members of the audience, right? I think that where folks are listening, and that's good, right? So most people picked all of the above. We'll talk about each of this in a little bit more detail. But yes, I'm glad that, yes, we're getting that message across. Okay, so yes, the answer is all of the above. And we're going to start with some of the commoner commoner risk factors. So I'd mentioned that hepatitis is a risk factor of liver cancer. Hepatitis B virus infections are more like patients who have hepatitis B virus, particularly African Americans, are more likely to die from their hepatitis B than non-white patients. I had mentioned before that chronic exposure to hepatitis causes cirrhosis. I think this is a good time really to pause and talk a little bit more about cirrhosis. Imagine if you get a cut on your skin. There may be some bleeding. After a while, that stops. And then there's some swelling, maybe a little bit of a pain, but eventually it will heal. And many times it will heal with a scar. A lot of the things that are risk factors for liver cancer, they cause injury to the liver. In an effort for the liver to heal itself, there is swelling, there is inflammation, and eventually there is, in a way, scarring. So it is this scarring of the liver that we call liver cirrhosis. As you can imagine, when there is a scar on the skin, The skin is not as supple, may not be as pliant as the rest of the non-scarred skin. In the same way, when the liver is scarred, the liver is not as supple, is not as pliant. It doesn't do its job as well as the non-scarred, non-injured liver. So hepatitis B, hepatitis C, which we'll talk about later, and all the other risk factors mainly cause liver cirrhosis. And it is with this liver cirrhosis that there's an increased risk of liver cancer. It is important to note that in contrast to some of the other risk factors that we will be talking about later, there are patients who have livers that have hepatitis B infection who do not develop liver cirrhosis, who end up still getting HCC. So I mentioned that risk factors affect the liver, cause the injury, and then there's a destination of cirrhosis before cancer. This doesn't always happen in hepatitis B. For hepatitis B, patients may have the infection and then go straight to cirrhosis before even getting to, and go straight to liver cancer before even getting to cirrhosis. Therefore, it is important to ask your doctor to screen you for blood for hepatitis B if you have never been vaccinated or tested. Now, we have a few guidelines around who should be screened or not, but this is a conversation that I think that you should have with your primary doctor, particularly if you've never been vaccinated and if you've not been screened in the past, and if you were maybe involved in some high-risk job. Because if you can be vaccinated against hepatitis B, then potentially we can reduce the risk of hepatitis B causing cirrhosis or hepatitis B causing cancer. Okay. Another risk factor for liver cancer is hepatitis C virus. Okay, next slide. The hepatitis C infection is a leading risk factor for liver cancer in the United States. Similar to hepatitis B, African Americans are almost 2 times as likely to die from hepatitis C compared to their white counterparts. The good news, the very good news here is that most patients that have hepatitis C, before they develop liver cancer, they have liver cirrhosis. Even better, hepatitis C can actually be treated and it can be cured. So if Black patients, everybody actually gets screened for hepatitis C and we treat their hepatitis C, our hope is that this will reduce the risk of liver cirrhosis and therefore eventually liver cancer. It is a little bit depressing, and there are a few reasons for this that we're not quite sure. It's depressing that Black patients with hepatitis C can develop HCC at earlier stages of their liver cirrhosis of liver disease than white patients. Regardless of this, I think that the key thing is that hepatitis C can be treated, and if we treat hepatitis C, then we can get rid of liver cancer that is caused by hepatitis C. Yes. Tina?
Looks like it's back to me for a poll question. Black Americans are more likely than non-Hispanic white individuals to die from Hep C. How much more? A, 10%, B, 43%, C, 88%, or D, 120%. Let me start the poll and read the question again. Black Americans are more likely than non-Hispanic white individuals to die from Hep C. How much more? A, 10%, B, 43%, C, 88%, or D, 120%. I see those responses rolling in. Let's give it about 10 more seconds. I see them rolling in, Dr. Olu. I know they're going to be ready for your explanation of this when we close the poll. About 5 more seconds here. And as we are getting ready to close the poll, don't forget, everyone, to your questions, make sure you add them to the question and answer section. I'm going to close the poll now. Let's see, what is that answer? The answer is 88%. Black Americans are almost twice as likely to die from Hep C. Dr. Olu, why is that?
Well, I have to blame Tina first because most people picked option D. So it wasn't entirely a trick question, but I guess we didn't word it as well as we could have. So I'm blaming myself and also Tina. Both of us are in charge of this. Yes, the fact is that Black Americans are almost twice as likely. So twice there is about 100%, rather than 120%. So I feel a lot of people picked D, rather than C. But that's the fact. It's almost twice as likely, almost 100%, die from hepatitis C compared to Hispanic white individuals. Um, Part of the reason is because they have more complications. Part of the reason is that they are also more likely to have other risk factors in addition to the hepatitis C. And the risk factor here that is unfortunately prevalent in our community is diabetes, type 2 diabetes mellitus. Um, as we know, Black Americans are again almost twice as likely to get type 2 type 2 diabetes, compared to white Americans. This is driven by a higher rate of obesity in the Black community. We also have a higher rate of complications from diabetes because of poorer glycemic glucose control. This is related to racial disparities, to access to healthcare in the United States. So it is important to actively manage type 2 diabetes. So type 2 diabetes on its own is a risk factor for liver cirrhosis and liver cancer. But in addition to hepatitis C virus, it's a dangerous mix when it comes to risk factors for liver cirrhosis and liver cancer. We have another question, and I hope that I've been very clear about the explanation for the next question. Tina? Okay, she has answered the question. Okay, so yes, so we were going to ask the question whether type 2 diabetes is an independent risk factor for getting liver cancer. The answer is already highlighted. I think I tried to say this in the previous slide, that yes, type 2 diabetes, in addition to increasing the risk when somebody has hepatitis C, on its own is a standalone risk factor for hepatitis C.
Yes, sir. I will move forward to the next slide.
Yes, let's do that. Okay, so we had also talked about obesity as a risk factor. Obesity actually has a medical definition. Okay, for men, we can define obesity for men and women actually based either on the body fat percentage, which is a little bit more difficult to measure, and the body mass index, which is a little bit easier to measure. We think that if a woman's body fat percentage is greater than 33% of the rest of her body, then that is obesity. For men, it's about 25%. I think the BMI is an easier way metric for obesity. It is based on the patient's weight for their height. And a BMI of 30 greater than 30 is considered obese. A BMI of greater than 40 is considered morbidly obese. I think that if you do not know your BMI, then there are calculators online that you can just plug in your weight and your height, and it will give you what your BMI is. You can talk to your doctor to discuss. Obesity is a risk factor that we can modify that can reduce the risk of liver cancer and a few other cardiovascular morbidities. Next slide. We need to talk about diet, because diet is also a risk factor for liver cancer. A diet that is very rich in red meats and fatty foods increases the risk for being overweight and obese, and also increases the risk of development of type 2 DM, which are risk factors that we talked about. So in general, we think that you should talk to your doctor about dietary or lifestyle changes that you can make. We we think that it is good practice with good quality evidence base to add a lot of fruits and vegetables with our diet. Um, Even if you don't lose weight after you have changed your diet, because this is a problem that people may have. Even if you don't lose weight if you change your diet, please note that you still get health benefits. So patients who do not lose weight, they still are able to reduce the fat in their liver. So this is another reason why, considering changing your diet is an important way to combat the risk of diabetes, combat the risk of liver cancer in this case. So next slide. We're going to round out our discussion of risk factors by looking at a few other lifestyle choices that we can make that can help us reduce the risk of cardiovascular morbidity in general and reduce risk of liver cancer in particular. So patients who are heavy drinkers, alcohol is a toxin. Patients who are heavy drinkers are more likely, 5 times more likely to get liver cancer than those who are heavy drinkers. The CDC recommends small amounts of alcohol, no more than 1 drink a day for women, no more than 2 a day for men. The best amount of alcohol is really no alcohol. I think that we should be, not I think we have good quality data that says that we should be treating alcohol the way we treat cigarette smoking. The best amount of cigarettes is no cigarettes. That should be the story too for alcohol. But as long as you're not having more than 1 drink a day for a woman, no more than 2 a day for men, we think that this is a good sort of level of moderation. I've talked about smoking. I don't think we can. I think everybody knows now that we should stop smoking. Never share needles. Never share needles. Even if it's for getting tattoos or for piercing. Sharing needles is one of the ways that hepatitis C virus can be transmitted, and therefore, if we want to reduce the risk of some of these blood-borne causes of liver cancer, then sharing needles has to be a no-no. Okay, we have another question.
Okay, is being part of a certain ethnic group a risk factor for getting liver cancer? A, yes. B, no. I'll read it again. Is being part of a certain ethnic group a risk factor for getting liver cancer? A, yes. B, no. I see those responses coming in. We'll give it a few more seconds to see if we get more responses coming in before I close the poll. A is yes, B is no. I'm going to go ahead and close the poll because I know you all want to get your questions in. So we have those questions for the Q&A portion of it. Dr. Olu, the answer is A. Tell us why certain ethnic groups have a much higher risk of getting HCC.
I think that, thank you. Yes, and yes, most of the members of the audience has gotten the message. There are many reasons, maybe genetic, but we think that a lot of it is really environmental. We've talked about all these risk factors, and I think some of these risk factors may just be more prevalent in our community than in other communities. So if we know the risks, we know the risk factors that are modifiable, then we can take action. So this particular graphic sort of summarizes some of the most common risk factors for liver cancer. And we would like to offer some real world steps that you can take with the help of your doctor to help reduce the risk of liver cancer. So hepatitis B virus, for instance, doesn't have a cure, but it is treatable. So if you are at high risk for hepatitis B, please ask your doctor to be screened. If you're positive, please work with them to help treat your hepatitis B. Hepatitis C can not only be treated, it can actually be cured. And the recommendation is that if you were born between 1946 and 1964, regardless of what risk factors you may have heard about for hepatitis C in the community, you should get screened for hepatitis C. When we screen people for hepatitis C, we can cure their hepatitis C. We know that Black patients with hepatitis C can develop HCC, hepatocellular cancer, at earlier stages of liver disease. So because of this, it is particularly important for members of our community to get screened for hepatitis C. For type 2 diabetes mellitus, it is essential to control blood sugar, work with your doctor to get this under control. To get the type 2 diabetes under control, making good dietary choices is important. If you drink alcohol, drink moderately, no more than a drink a day for women, no more than 2 for men. This is really because men in general have bigger muscle masses and are able to have bigger muscle masses really, and maybe they're able to do better with a little bit higher dose of alcohol than women. We always advocate to never share needles, and that's if you stop smoking, you will do better overall with a multitude of cancers, a multitude of health problems. Finally, Black Americans are at a higher risk for liver cancer. And just like we're doing now, just getting all the information and education that you can get is particularly important for reducing the risk of liver cancer in our community. So we're going to switch gears now and talk about how liver cancer is diagnosed. So I had mentioned that most people who have liver cancer, about 85% of people who have liver cancer, they have liver cancer after they have been diagnosed with liver cirrhosis. Most people will not be diagnosed with liver cirrhosis unless they have been following up with their primary doctors regularly. So if you're not following up with your primary doctor, then you can't get screened for some of these causes of liver cancer. If you're not getting screened, then we don't know that you have liver cirrhosis. If we don't know you don't have liver cirrhosis, then we cannot do some of the imaging tests that allows us to surveil you so that we can pick up liver cancer sooner. Therefore, most people who have liver cancer will come to us when they have symptoms. A few patients will come because they have been screened, but most people will come when they have experienced symptoms. With those symptoms, we do imaging tests like CT scans and MRI scans. And then when you're seeing your doctor who specializes in management of liver cancer, we do lab tests, including the blood counts and liver function tests. For hepatocellular cancer, in the right context of imaging, we don't generally do a biopsy to make a diagnosis of hepatocellular cancer. But if you have the less common form of liver cancer, say for instance the bile duct cancer, we may need a biopsy to get to that diagnosis. It is important to know that a cure may be possible if liver cancer is detected early and removed by surgery. It is therefore important to make sure that if you have been exposed to some of the risk factors, if you're experiencing some of the risk factors that we talked about, then screening through your doctor is an important way to catch liver cancer early so that we can cure liver cancer. Okay, next slide. When we diagnose our patients with liver cancer, we try to figure out how serious the disease is. We do this through a process called staging. Okay, in staging, we want to better define the tumor, and in this case, we also want to figure out how well the liver is functioning. So, in patients that have liver cancer, we have unfortunately two problems, because most people have had liver cirrhosis before they have liver cancer. We're having a situation where their liver that is scarred is not functioning as well. That is a problem. And sometimes that may even be a bigger problem than the liver cancer that they are seeing me for. But we do staging to assess the tumor, and then we also assess the liver function. Okay, the liver function, we use a liver function to assess, one, whether the liver is functioning very well, which we would call a class A liver function. If there are small changes in how well the liver is functioning, we'll call that a class B function. And if there are major abnormalities in the ability of the liver to do what it's supposed to do, then that's a class C liver function. And we put all of this together in addition to whether the tumor is remaining within the liver or whether it's spread outside the liver, to come up with a good stage of the liver. And based on all this information, next slide, we classify liver cancer into 3 stages. There's the early stage cancer and there's the advanced stage cancer. In the middle of both early and advanced stage cancer is the intermediate stage cancer. Okay, early stage cancer can be cured. It is curable because the tumor can be completely removed by surgical resection from the liver, and we still have good liver, good, adequate, healthy liver function left. In patients who have a relatively small liver tumor, but whose liver function is not at an A or maybe a B, we may offer a transplant, which again potentially can cure these patients. Okay. In the intermediate stage, the liver cancer is not resectable because, one, either because it's spread to the lymph nodes, or because the patient is not in a good position to get a resection. Some patients, their tumor is staying within the liver. They're in a good physical, healthy state to get resection, but the liver is so widespread within the liver, the tumor is so widespread within the liver, we still cannot resect it. This will be considered intermediate stage disease. Cancer in advanced stage is cancer that has spread to the lymph nodes or other organs outside the liver. So we have another question.
Absolutely. So here we go. Let me go ahead and start the poll because this is a pretty long one. What are some reasons liver cancer cannot be treated with surgery? A, cancer has spread throughout the liver. B, the tumor can't be removed because of where it is in the liver. C, patients are not healthy enough to have surgery. D, patients refuse surgery. Or E, all of the above. I'll read it again. What are some reasons liver cancer cannot be treated with surgery? A, cancer has spread throughout the liver. B, the tumor can't be removed because of where it is in the liver. C, patients are not healthy enough to have surgery. D, patients refuse surgery. Or E, all of the above. Looks like we have pretty good responses already coming in. So I'm going to go ahead and close the poll and Dr. Olu, allow you to go ahead and share why the answer is all of the above.
Yeah, so the answer is all of the above. As you can imagine, if the tumor cannot be removed because of where it is in the liver, this is what we say is technically unresectable, and therefore it will be dangerous to go and remove it. Also, if it has spread throughout the liver, then short of taking out all of the liver, then we cannot resect it. The problem is if it has spread throughout the liver, we always worry that it may already be in the bloodstream. Some patients really do not want surgery, and some patients are also not healthy or strong enough to have surgery. Okay, so we will talk a little bit more over the next few minutes as we wind down about the treatment options. Okay, so for early stage disease, the main treatment option when the cancer is caught early is local therapy, because this gives us a chance to actually get rid of the cancer and cure the patient. We can do the surgeons can attempt to remove the surgery as the tumor if the remaining liver will be healthy enough and adequate for the patient to perform their usual day-to-day living. If it's a small tumor, but the liver is not healthy, which we will call like the function type C, then in this case, if the surgeon goes to remove the tumor, the liver may not be able to handle the rest of the day-to-day functions of the liver for the patient, and then that liver may fail. So in these cases, we offer the patient a liver transplant where the whole liver is removed and a donor's liver is put in its place. We always hope for the best, and in about 70% of patients, through either of these means, we're able to get rid of the cancer. However, there's still a small chance that the liver cancer can come back. So even after we've done this procedure, we still follow up with the patients regularly to make sure that we continue to surveil them. And if the cancer comes back early, if the cancer comes back at all, we may be able to do something about it to get rid of the cancer. The next slide, we'll talk about the intermediate stage treatment options. Okay, this is typically using options that are non-surgical approaches. Ablation is also used in early stage disease where, for whatever reason, we're not able to offer a resection. So we use it both for early and intermediate stage disease. Embolization plays the main role in the management of intermediate stage disease. In this case, we isolate the blood vessel that supplies the tumor, and then we inject substances into that blood vessel that blocks blood supply to the tumor. In that way, we are hoping that we're killing the tumor through this blockage of blood supply. A few cases, we're able to offer radiation therapy with high energy radiation to kill the cancer cells. Again, for many patients in the intermediate stages, these approaches will stop the tumor in its track, but it can still get worse later. So we continue to check the patients and make sure that they are doing well. So next slide.
Okay, we'll go quickly through this poll question. There are no treatments for advanced liver cancer. True A, B, false. What do we say? Let me go ahead and start the poll. There are no treatments for advanced liver cancer. True A, B, false. Let's see, I see responses coming in. Let's see. There are no treatments for advanced liver cancer. True A, B, false. I'll go ahead and close the poll now. Let's see what the answer is. The answer is B, false. Although there are no curative options, there are many medications for advanced liver cancer. Dr. Olu, share more.
Yes, thank you very much. And I think this is one of those ones where you do a pre-test question and then you do a post-test question. I don't know whether we have a post-test question, but we didn't talk about advanced stage cancer. This is where I come in to see patients. So patients who have early stage cancer may not see me. Patients who have intermediate stage cancer will probably see me. And then patients who have advanced stage disease will definitely see me. Fortunately, 80% of HCC patients are diagnosed in advanced stages. Okay, we're not able to cure this cancer, i.e., we're not able to make these cancers go away, but we're able to treat the cancer with the goals of helping the patient's quality of life and actually helping them to live longer compared to offering them no treatment, particularly if their liver function remains good. Okay, so the way we treat advanced stage cancer is we give you treatment that goes all over your body. We think that cancer is advanced because it spread from the liver to the lymph nodes and to other organs. The way it does this is that it gets into the bloodstream. So we think that the way to treat this cancer is to give you treatment that goes all over the body through the bloodstream. Today, our best treatment is with immunotherapy. Immunotherapy wakes up the immune system. The immune system then fights the cancer. Other treatment options that we have used here are considered targeted therapy. These are treatments, typically pills, that you take by mouth, okay, that go to target specific mutations in the tumor that are necessary for the tumor to continue to grow. Today, in the United States of America, chemotherapy is not one of the big things that we use for treating this cancer, which is good news for many of our patients. We tell them we do not treat liver cancer with chemotherapy, particularly HCC, which is with immunotherapy and targeted therapy treatments, which are generally easier to tolerate. Next slide. So for the treatment slides, I think the take home, what I would like for you at home to keep at home, is that if you have been diagnosed with liver cancer, you should not lose hope. Even for patients that have advanced disease, there are FDA approved treatments. You need to find doctors that specialize in the management of liver cancer. You need to find a medical oncologist who specializes in HCC. You need to find a liver doctor, hepatologist. You need to find a digestive system doctor, a gastroenterologist. Even in the absence of FDA approved treatment options, we here at Winship, we have opportunities to try to offer clinical trials to patients, particularly when there are no longer FDA approved treatment options. So the take home message is work with your doctor. Don't lose hope. We may still be able to help. Next slide. So in addition to working with a liver cancer specialist, you can also pay attention to a few things. Work on managing your weight. Try to stay active. Eat a healthy diet. And stay hydrated. These are just good things to practice in day-to-day living. And there are always resources available through your oncologist, through the internet, and through patient support groups. If you ever have to go through this journey of liver cancer. Okay. So I think that we've come to the end. We should recap. You have gotten a little more educated. I think if 5 people hear this and each of them sends this message to 5 different people, we're already capturing, larger numbers than actually saw this talk. So please share what you have learned with your family members and with the rest of the community. It is important, not just for liver cancer, but just for a general good quality long life, to make healthy choices about diets, about managing weight, about diabetes, about smoking cigarettes, and as much as possible, work with your doctor towards controlling your blood sugar if you have diabetes. We think that getting a physical every year could uncover risk factors that you can work on. If you do have risk factors, see a doctor who can help with reducing some of these risk factors. So it is very important to continue to keep in touch with your primary doctor. Okay. So.
All righty, here is the last poll question. So we definitely want to make sure people stay on for at least another few minutes so we can get some of these questions answered. So please do stay on for that. After this seminar, though, we want to hear from you. What will you do? A, make an appointment with your doctor. B, get screened. C, tell your friends about this information, or all of the above. After this seminar, what will you do? Will you make an appointment with your doctor, get screened, tell your friends about this information, or all of the above? Let us hear from you. What will you do? A, make an appointment. B, get screened, tell your friends about this information, or all of the above. I see the responses coming in, and it looks like it's a resounding same response of what we're seeing coming in. I'm going to go ahead, because everybody's saying the same thing. I'm going to go ahead and close it, and everyone is going to take action now, take action for their health. tell their family and friends and share information about the community. We want to go ahead and thank number one, thank the Blue Fairy, the Adrian Wilson Liver Cancer Association, thank AstraZeneca, thank Exelexis, thank ASI, Merck, and Genentech for their support. We want to go ahead and really jump into the question and answer section, but we want you to go ahead and visit to learn more. Love Your Liver US. That is Love Your Liver. I'm going to go ahead and spell it for you so you can learn more about liver cancer. LOVEYOURLIVER.US, or you can just scan the QR code that's here on the presentation. We're going to jump right into some of the questions. Now, remember the guidelines here. We cannot ask Dr. Olu questions that are specific about your health, but we do have some good ones that are coming in. Please do not disclose any of the personal health information because I'll just have to skip right over those. Those are for you and your doctor. And we apologize if we can't get to any of your questions in advance. But we do have a good one. Dr. Olu, are you ready?
Yes, thank you.
What is the main reason, or one of the main reasons, why African Americans are being diagnosed so late or at a later stage with liver cancer?
This is an excellent question. Generally, when people say this is that's a good question, it's usually because the answer is stumping the answerer. We don't know why. So we know that even when African American patients with hepatitis C, even when we follow them very closely, we screen them for liver cirrhosis, they do everything religiously that they're supposed to do. On average, we're still diagnosing African Americans with liver cancer at an earlier stage in the evolution of their disease than, Caucasian Americans, for instance. We also know that they tend to present with more advanced stages of their disease when you compare person for person. Not very sure why this is happening. This is being investigated by oncologists and people who do, those of us that research this. I think part of the reason is that there's an interplay, right, of factors. So we talked about how, unfortunately, we have a higher risk of patients having diabetes, being obese, and then putting hepatitis C on top of that. So whereas maybe other communities may have just one risk factor that their liver has to deal with, our livers are having to deal with maybe a multitude of factors. Maybe there's some genetic reasons. I wouldn't go to that area. I really think that it's really more a bunch of environmental reasons, like diabetes happening in the same person and obesity, and then hepatitis on top of that. But it's really not clear yet.
Thank you so much. And we have just a couple more I want to ask you, just in respect of your time, please, doctor. Just going to combine two. Is high cholesterol a risk factor for liver cancer? And what are some of the symptoms of liver cancer, if there are any that you can call out tonight that will resonate?
So, very good question. So, high cholesterol in general doesn't stand alone. Unfortunately, it stands in a family of other metabolic problems. So, like diabetes mellitus, sometimes obesity. There are patients who don't have diabetes, who don't have obesity, who have high cholesterol. Those patients, probably high cholesterol on its own will not be a big risk factor for HCC. But when you had high cholesterol with a few of the other siblings that come along with it, then we have that risk factor. Then we have that combination as a risk factor for HCC. Regarding the symptoms are really symptoms of liver cirrhosis. So patients whose livers are not working well, they begin to lose weight. The liver makes a protein that helps you keep blood in your blood vessels, keep fluid in your blood vessels. When your liver is not working well, then that protein is not made, and then instead of fluid staying in the blood vessels, it starts staying in places it shouldn't go to. So people get bigger, so their bellies get swollen, their legs get swollen. Some people will have pain. Other people, their eyes will turn yellow. Again, because that bilirubin that the liver makes, the liver is not able to get rid of it properly, so it spills into the blood. So, weight loss, yellowness of the eyes, swelling of the body in general. These are some of the of the symptoms of liver cancer. But some of these symptoms can be caused by other diseases that are not cancer. So it is very important that you talk to a healthcare worker, a physician, a physician assistant, a nurse practitioner, somebody who's knowledgeable in the area, to see whether what may be going on if you're having some of these symptoms.
Thank you, Dr. Olu. And just one more question. I want to be respectful of everyone's time. Is there hope if one has liver cancer?
Certainly. I think that towards the end we started rushing because we wanted to be respectful of everyone's time. But that is another message that you should sit. That is the message you should sit with at home. That if you have liver cancer, there is hope. If it is early stage liver cancer, that cancer can be cured. Even if it is advanced stage cancer where we can't cure it, we can treat that cancer. We can help people live longer with that cancer, and we can improve quality of life. So some of the symptoms I described, when we treat the advanced cancer, those symptoms get better. Thank you.
Thank you so much, Dr. Olu, for this engaging discussion on liver cancer, about this risk factors and the impact on our community, the African American community. Thank you for each of you for taking time out of your busy day to learn more about liver cancer. Don't forget to visit loveyourliver.us. There's so much information there. That's LOVEYOURLIVER.us. Learn how you can help yourself and help your loved ones. Make sure to prioritize your liver health. Go see your doctor for your regular checkups. Talk to your doctor about your risk factors. Believe in your health first. Remember to visit the website or scan the QR code to learn more. We thank you so much for your attendance on this health education event during the last day of Black History Month. Have a good evening.
Thank you. Have a good
Thank
evening.
you, Dr. Olu.